Okay, so also included with our pelvic binders is these tourniquets. So another thing that we found when our patients come in to us with massive trauma, if they have, severe traumatic injuries to the legs or arms or whatever, stopping the bleeding there is actually, we never really had any devices that were meant for that purpose. EMS has them, but however, sometimes people get dropped off at our door and we have to figure out what to do. So I just wanted to show you guys how these are applied. They're pretty straightforward. They're kind of fun little devices. So they come out of the bag literally like this. So you pull them out. They're a Velcro strap. So they're adjusted. So you can open them and close them as you sort of see fit. Okay? There's this little loop here that you can sort of pull on if you want to wrench on it, but chances are you're not going to wrench on it that hard. And basically the way that this works is you twist this stick until it gets tight enough. So I'm going to do that with my lovely assistant here. So you want to make sure that you open up this tab here so that you've got these little hooks available to you. So you apply it to the affected limb. You want to, so there's debate as to how close to the injury you want to apply a tourniquet. Ideally, you want to go above the joint of where that injury is. So if the injury is down here, then you want to try to go above the joint, the next joint for it, okay? So we're going to go ahead and apply this tourniquet, and you're going to apply it as snugly as you can just with the Velcro. And again, you can actually use this handle to wrench on that and get it nice and tight. Once you've got that part applied, you have the stick here, so you basically take the stick and you twist it, and it'll get tight fairly quickly, right, Stephanie? So the way that this goes, so it's good to find a pulse that is distal to where you're applying the tourniquet, and you're going to keep twisting until you no longer feel that pulse. Once you get to that point, then you're just going to continue on. That's probably super tight stuff, I'm sorry. And then you go ahead and just secure it into the gap there, and then you close this up. You'll notice here that there's the word time. Again, same thing with our pelvic binders. We're cutting off circulation to this arm. This is, again, physician dependent and situational. You may or may not have a physician who wants to restore circulation on regular intervals, which Stephanie's probably really anxious for me to make that decision right now. So we're going to go ahead and do that. So you saw how I disengaged that. I just pulled the stick out of the engagement and just let it go. And then you can stop the Velcro and pull it off. So make sure you time and date these things. And again, guys, once you've got these applied, you're going to have to do frequent reassessments, probably every 15 to 30 minutes at minimum. And check with your doctor to see if they want to have intervals of recirculation or not. Again, very physician dependent, and then that's pretty much how they work. They're pretty straightforward. The other, I guess, quick thing to mention, so we've only got a few of these things, and the likelihood of them returning to us when we send a patient out is not very high. However, if we can sort of communicate with the EMS staff that when they bring a patient over, if they can return things to us, great. If they can't, then it is what it is. But yeah, if we can minimize the losses there, that would be great, with the understanding that it's more likely not going to come back to us. And that's it for the tourniquets.